How does an eczema biopsy help diagnosis? Have you ever wondered how a small piece of skin can provide so much information about eczema? An eczema biopsy is a key tool in understanding this common skin condition. Let's break down how it works and why it can be important for diagnosis. When a doctor suspects eczema, they often start with a clinical examination and a review of your medical history. However, sometimes the symptoms can be confusing or severe. This is where a biopsy comes into play. It involves taking a tiny sample of the affected skin and examining it under a microscope. Before the procedure, the doctor will numb the area with a local anesthetic to minimize discomfort. The actual biopsy is quick and usually performed in a doctor's office. Once the sample is taken, it is sent to a dermatopathologist who specializes in skin diseases. They will look for specific features that indicate eczema, such as thickened skin layers and swelling between skin cells, known as spongiosis. In cases of acute eczema, the swelling is more noticeable, while chronic eczema shows ongoing inflammation and thickening without much swelling. This microscopic examination can confirm the presence of eczema or help rule out other skin conditions that may look similar, like fungal infections or contact dermatitis. The biopsy can also uncover more serious issues, such as cutaneous T-cell lymphoma, which is a type of skin cancer. Additionally, it can identify secondary infections or abnormal cell growth that might change how the doctor approaches treatment. Typically, you can expect to receive the biopsy results within a few days to a week, depending on the lab's workload and the complexity of the analysis. This information is essential for doctors to make accurate diagnoses and tailor treatment plans effectively, especially when standard treatments are not working. While an eczema biopsy is not a routine procedure, it becomes a valuable option when symptoms are persistent or atypical. The healing time for the biopsy site is usually about 1 week, making it a relatively low-impact procedure. So, if you are experiencing severe or unusual eczema symptoms, discussing the possibility of a biopsy with your doctor could be a beneficial step toward finding the right treatment. Understanding the role of a biopsy can empower you to take charge of your skin health.